Welcome to this episode of Rattling the Bars. In prisons all across the United States, COVID has been devastating the prison population. Here in Maryland, it's then hit the prison population especially hard. I have joining me today two guests that can give us the inside story and the outside story of what's happening to the prison population in relationship to COVID-19. Marc Schindler is the executive director of the Justice Policy Institute, and they do research all across the country. Miss Pamela Sessoms has a fiancé inside the prison system, so she has inside information. So thanks for joining me, Marc and Pamela.
Thank you for having me.
Okay, so Marc, could you give us an overview first of what's going on, the numbers involved in terms of prisoners in Maryland and how many deaths, and also about the correctional officers?
Yeah, absolutely. And again, thanks for having us, Eddie. I particularly want to thank you for having Pamela on. I think it's so important, and the story that she has to share is one that people in Maryland should hear, including the governor and others. So thanks for having us. And as you know, Eddie, this issue of COVID-19 in jails and prisons is a crisis that's not getting enough attention. Literally thousands of people dying across the country. And Maryland, while in some ways has done reasonably well, in other ways is really failing. And so we've already had, I think the last count is 8 incarcerated people die. I believe we've had 3 correctional staff who have passed away. And importantly, the 2 things that we know that can be done to try to stop the spread in jails and prisons has not been done consistently enough in Maryland, right? And so we know prior to the vaccinations being available that testing is really the way to head this off. And I'll give credit to the governor when he announced that they would test everybody, incarcerated people and staff in prisons, because really it should be the same approach as the state was taking with people in nursing homes, because it's a very similar type of environment. It's a long-term congregate care environment with vulnerable people, and it's very difficult to social distance and do the other types of things that we know need to be done to stay safe. And so it was good that the state said that they would do the testing proactively. The problem has been in the implementation. They essentially seem like they did 1 round of testing, but of course we know you have to keep doing it so that you can see where the spread is happening. And unfortunately that didn't happen. And what we saw is in a couple of facilities around the state, they had very serious spikes of COVID, where we literally had staff and incarcerated people testing at 100% of those being tested were testing positive, right? And that clearly shows that the only people they're testing are those that are showing symptoms, and that doesn't really help to stop the spread. Thankfully, in recent months, with some attention to this issue, they seem to have ramped up their testing again, and that's important, and they need to continue to do that, including testing people who are not symptomatic, right? Testing people to make sure they can track the spread. Now that we have the vaccines, it's critically important that they make the vaccine widely available to staff and incarcerated people. This is absolutely critical. And so they need to do better on that. They're starting to show movement on that, but they need to really ramp it up. The last thing I'll say on this is we know that 9 out of 10 outbreaks of COVID have been in jails and prisons. The major outbreaks in the country have been in jails and prisons. And that's important because people in jails and prisons, as you well know, are incredibly vulnerable. And so we have to protect them. It's also equally important is that it doesn't stay in the jail or prison. Of course, staff are going in and out every day. And so those surrounding communities are in danger as well when there's a COVID outbreak within the facility. And so the state of Maryland really needs to get on top of this. They've done a bit better in terms of their testing and vaccines, but they need to do much better. Finally, they've taken some steps to try to reduce the prison population. The governor signed an executive order to try to accelerate and have some people released, but that didn't go anywhere near as far as it needed to. It was very narrowly drawn. And I think what you'll hear from Ms. Sessoms is a perfect example of how the state needs to do much better in terms of releasing vulnerable people, and where this intersects is something we've talked about before, Eddie, with the parole system, which is unfortunately broken in Maryland. And Ms. Sessoms can speak more to that, including how the broken parole system now is intersecting with this COVID crisis.
Okay, thanks for that overview. Ms. Sessions, do you mind if I call you Pamela?
That's fine. That's
okay.
fine.
Pamela, what are you hearing from inside, from your fiancé, from other people? What's the conditions inside?
Well, he's terrified because he contracted the virus back in May. He was on a ventilator for 7 days. He came out and he quarantined for 14 days at another facility that was holding a quarantine patients. And he was placed in an area where everyone was supposed to be negative. But the prison was taking in inmates from other prisons that were positive to put them in the quarantine area. Then they ran out of room in that area, so they started shifting those people in different areas of the prison. Then they had a fire at the prison in one building, so everyone from that building, they just spread them out. Now, as far as testing, they were testing, but they were moving people from building to building before the results would come back. And then once the results came back and they found someone there that was positive, they would have to move that person and all the people around them to another building. So it's at MCIJ, and they just had an outbreak about a month ago of the new variant, the UK variant, and they started testing again. And they realized, like he said, 100%. I mean, the staff is who's bringing it in, because the inmates aren't going anywhere. So I feel like if you would testing with the staff, and you wouldn't have that outbreak in the prisons. But I don't feel that he feels that there's not enough testing. As far as vaccinations, the correction officers just started getting vaccinated last month. And so at the end of last month, the beginning of this month, they'll start testing the more vulnerable inmates. Now, as far as when he contracted the virus, he didn't know it. He had been sick for a week, and we had called in wellness checks, and it was like, okay. So that morning, before he was rushed out to the hospital, I had called his attorney, and she had said that his case was on the governor's desk, and he didn't get a chance to hear it until he got out of the hospital. So he waited a couple of months, and this was in May, and he heard in October. The last week of the 181 days, he heard that he had been denied. Now, he has been in prison for 36 years. He has lost every family member except a niece and her children. So by the governor saying, once the parole board says, because that wasn't his first time going up before the parole board. He had went up before 3 other times. This was the first time that he had actually was recommended by the parole board to go to the governor. And I mean, with the pandemic going on, I think those people are some of the ones that should be released. He had did 36 years and he had contracted the virus. And we're not sure whether, if the doctor was here, I would want to ask him, can you get reinfected? Or if a new variant comes, can you get that variant? Because, so it would have been just best for the governor to have just let him go. I mean, he hasn't had any problems since he's been in jail. He has no tickets, not been in trouble. He doesn't, he works, goes to church, and that's it. And he had his evaluations, and his evaluations seemed to come out okay, except the last one from the doctor that has since been let go. And I think that's the decision the governor, that's the evaluation the governor made his decision on. And so I feel like if the commissioners said yes with the both evaluations, the commissioners say yes, and then you go up before the governor, I feel like the commissioners, they know more about the process. They know more about the inmates and the process, the amount of time they have had, they have more access to all that information, more so than the governor. Now, he did let people go, but they were already 100 and some days out from leaving anyway. They were being released anyway. So that really did not help those who are elderly, that are ill, but they're not on their way out the door. That's what we need. That's what we need.
Yeah, and in fact, I thought there was a request, Marc, and you can correct me if I'm wrong, for the governor to release a couple thousand elderly prisoners, but instead he released short-term misdemeanors, people with 6 months and so on. But he didn't do anything about the senior citizens at all. What's being done about that, Marc? Is there any kind of legal action being taken?
Yeah, that's a terrific question. There has been litigation, and there's a couple of things going on right now. And I think Ms. Sessoms, what she has shared with us is just a glaring example of how the system, with the governor's role in the parole process, is not working, right? And so we have thousands of people, as you know, who are elderly, over the age of 60, in our Maryland prisons, who are very low risk to reoffend, but very high risk to contract COVID, right? And so there's no reason that they should be kept there. We have legislation literally being voted on this week, once again, Eddie, to remove the governor from the parole process. And it's time for the legislature to do that. Ms. Sessoms, correct me if I'm wrong. The way I understand it is that your fiancé, who as I understand, has been incarcerated for over 35 years. He is one of the people who went to prison on a life sentence eligible for parole when he was a juvenile, so under the age of 18, which the Supreme Court has said he should have a meaningful opportunity for release. He went before the parole board. The parole commission was recommended for release, then contracted COVID, was hospitalized, placed on a ventilator, and then returned to the prison, at which point then the governor denied the recommendation or the request that he be released.
Exactly.
If I have that right, I cannot understand how someone who has been recommended for parole by the parole commissioners, as you said, people who looked at his case very closely, who met him and looked at how he would do, then contracted COVID and was on a ventilator and hospitalized and went back to prison. And then the governor rejected the recommendation for him to be released. I can't imagine how anyone could conclude that the system is working in that respect, either as it relates to COVID or as it relates to the parole process.
And let me just jump in a minute, Marc, because something else Pamela said that's very important. They stopped all outside guests from coming in. Outside visitation was stopped, but yet they allowed transfer from prison to prison, from building to building of other prisoners that may, in fact, I believe from MCIJ, they send a number of prisoners into JCI, and it spread an infection in that particular prison. And then
Yes.
they had a massive shakedown in which they pulled all the prisoners out and the guards came face to face in contact with them. This seems like some bad policy in the prison system. Public safety itself seemed to be deliberately putting prisoners, in particular elderly prisoners, in harm's way. Is there anything that can be done about that? First, and before, Marc, I want you to answer that, but how do you feel, Pamela? Is this stress on you, your family, and so on? How is this sitting with you?
It's very stressful because I live in another state. So I was going to visit him. At least he got, like I said, he lost all his family except his niece. So I was the only one and her in his life that could visit, so his home plan is with her. So if necessary, I would have moved back to Baltimore, back to Maryland. So to me, I see him study, more so, he's not physically ill, but emotionally, it's taken a toll on him. It really is. It's taken a toll on him. And now it's started him to get medical issues. He has high blood pressure now. And, it's just, like you said, the governor, whoever's running this, whoever's making these decisions, they need some assistance in how to go about taking care of each. If each prison is on the same mandate, but each one on doing their own separate thing when it comes to shifting prisoners, testing, and it's very important that the correctional officers be tested. They should be tested at least twice a week. Because if you're constantly bringing stuff in, like you said, they're not testing the ones that are asymptomatic. So they can bring it in to the prison because the inmates aren't going anywhere. So they're not going to get it from anybody. The correctional officers are bringing it in. So that means the asymptomatic officers are not being tested. All the officers should be tested at least twice a week.
And I understand. And Marc, back to that question. I hope you remember it because I forgot it. But also, I understand there's a number of officers are refusing to be tested and refusing to receive vaccine. So talk about the prison policy and what needs to be done about that, Marc, please.
Yeah, I'm glad you raised that, Eddie. We've just touched on the things that could be done and the challenges they're having inside in terms of the conditions, right? I talked about, and Ms. Sessoms talked about the need for testing and vaccinations, and that absolutely should happen. And I'll talk more about that, but also just basic PPE, the protective equipment and measures and masks. What we're hearing from folks on the inside is that those types of basic protocols are not being followed at all. And so there's very basic things that should be happening to try to protect both incarcerated individuals and staff. You mentioned, of course, the vaccinations. That's an issue both with staff and incarcerated people. As we know, there are people who are reluctant to take the vaccine, particularly within the African-American community, and that's understandable because of the history that's gone on within the medical community. There's an understandable apprehension by many people of color to take the vaccines. But we need to be able to educate and incentivize people to do that, both incarcerated people and staff. What we're seeing in other states dealing with this is they're starting to create incentives for incarcerated people and staff to take the vaccine. And we've just communicated yesterday with the Department of Public Safety and Correctional Services and strongly encourage them to do that and to look at what other states are doing. So for instance, in some states, they're providing good time credits, which Maryland can do under its regulations, to provide good time credits to incentivize incarcerated people to get vaccinated. They also, some places are providing financial compensation, putting money in a commissary account. There's a number of things that can be looked at to strongly encourage and incentivize both incarcerated people and correctional staff to take the vaccine. It's a tricky question about whether staff can be forced to take the vaccines, and there's litigation going on around that. But I think what they should be doing is incentivizing them and educating them, just as needs to happen in the wider community. Those are the types of things that absolutely should happen. And my hope as well is that the governor will take action, and the legislature will take action in the next week or so to finally remove the governor from the parole process, because as we're hearing, that's keeping people in prison who are at high risk, who could be safely released.
Mm-hmm. And what about the inter-prison transfer of prisoners? That should be stopped. I mean, it seemed to me that that's a source. I mean, if you don't let outside visitors come in, why would you send in 36 outside prisoners? Is there some way that can be raised with the Department of Public Safety in terms of stopping those arbitrary transfer? You don't know who's being transferred, and then even if they were safe and healthy, they don't know what they're being transferred into.
That's right. No, you're absolutely right. Those types of things should absolutely be done. And I think the legislature and others should be asking hard questions of the governor and the Department of Public Safety and Correctional Services about those types of practices that are going on. This is a crisis within our jails and prisons that needs to be addressed. Again, they're doing some things, but they need to do much, much more. And there's real concern. And I absolutely, my heart goes out to Pamela and others who have loved ones within these institutions, because they're very vulnerable and they're at great risk.
Yeah, and I'm thinking, Pamela, and I know there were like organized activities, groups in Maryland and in Baltimore that's rallying. And of course, I realize you're not here, but they are doing letters and stuff.
Yes, I'm still involved. I'm still involved from here. I'm still involved. Yeah, I go to Zoom meetings, I email, I call, yes, I'm still involved, even though I'm not there. I'm able to be involved. And I don't know, I just wish they would send them home. There are the people that should be able to come home, people that are on cane, that have canes, they can't hardly walk, they're in their 70s, release them. I mean, they're at a low risk, like he said, they're at low risk for re-entry, but they're at high risk to contract the virus. And by them moving different inmates from different prisons, you're bringing in different variants. Like you brought the UK variant to MCIJ. Now, I don't know if that was another inmate. I don't know if that was a correctional officer. But if you are working in a situation like that, because for instance, my fiancé told me that they moved him twice. And both times he had to clean his own cell because they moved someone who had COVID out of there, moved him in there, and moved that COVID patient somewhere else with other patients that are not positive. There's not enough room to quarantine, isolate, and have negatives and positives. There's not enough room in the prisons. They're just not. That's why they're intermingling. That's why you come on, even though you've been tested, let's go over here. And then you find out you're positive, you got to move again. And there's no, like he said, there's no PPEs. They have to clean their own areas themselves. And they have to use what they can.
Yeah. Pamela, tell me this. If you could say something to the governor, and you can right now, what would you say?
I would say, Governor Hogan, I appreciate everything that you have done for the prison system, for the inmates. but there's a lot more that you can do for those that are left in there, those that are more vulnerable, those that have served over 20 years. There's more that you can do as far as keeping them safe. I don't feel that my fiance is safe in your institution. He almost lost his life there. And he's been in there for 36 years. And he's almost lost his life there because of the process. And thank you very much. That's it.
Okay. Marc, if you had some advice for the public, what they could do, how they could help support this effort to change these policies, what would you say?
Yeah, thanks, Eddie. There's two things I would say. One is critically important now to contact their legislators and to say that they should move to remove the governor from the parole process finally. Take the politics out of parole in Maryland so that the parole commission can do its job. So that's number one. Number two, they should be contacting the governor and urging him and his administration to do more as it relates to the COVID crisis in our jails and prisons. They have to get people out who are low risk to reoffend, and they have to make sure that there's protective measures inside, including testing and vaccines. So those are the things that they should be doing, and they should be listening to people like Ms. Sessoms, who understands, and people, quite frankly, like you, Eddie, who understand that we cannot allow people who are so vulnerable not to be cared for appropriately. We have a moral and ethical obligation to do that, and we have a public health obligation now with the virus. So it's critically important that people let the governor and legislators know that.
Okay, so thank you for joining me, Pamela, Marc.
Thank you. Nice for having me. Thank you for having me.
Thank you, Eddie. I appreciate you always.
Okay. And thank you for joining this episode of Rattling the Bars. Please support this show so we can continue to bring you news from behind the bars. The Real News and Rattling the Bars do not accept government donations. We do not take advertisement. We rely solely on support from our viewers and our sponsors and so on. So please donate if you can so we can continue to look at what's going on behind the prison walls. Thank you.